Hi everyone, I'm Dr. John and you are watching Shooting Up in the Dark, where we discuss all things related to addiction, chronic pain, and opioid use. In this segment, I'd like to discuss drug tolerance and drug dependence. These are two phenomena that are really critical to understand if a person is to understand really what addiction is. And I hate to give a presentation that's a little dry, and I guess describing these might be a little dry, but a lot of confusion that you might have, and certainly that other people have, is cleared up once you understand drug dependence and drug tolerance. I'll give you a couple examples of where this comes up. Like people will often ask, well, is a person who takes chronic opioid medication addicted to their medication? And it turns out that usually no, they're not, but people use the term addicted and mean different things by it, and it has a lot to do with drug dependence and drug tolerance. And so I'm going to go ahead and explain what these are and try to do it with some examples so that it'll be a little bit more clear. A major goal I have is to help people get a solid and accurate idea of addiction. Before my addiction problems, and even after many years of medical practice, I'll be the first to admit that I was basically ignorant. I didn't really get addiction, why and how it happens, what it actually is, what a life in addiction looks like. So if healthcare providers tend to have a poor understanding of addiction, then most of the rest of today's society likely doesn't understand addiction very well either. Okay, so there are two naturally occurring phenomenon, natural consequences, that result whenever any person takes certain medications, including opioids, over a period of time, like months, years, or more, or when they drink alcohol regularly. And these are called drug tolerance and drug dependence. So to explain these, let's take an example. Let's suppose that you have a painful lower back problem which persists after surgery, and other treatments have been done, spinal injections, whatever. And after making sure that all the necessary tests are done, and make sure there's no additional undetected problem, you and your doctor decide, because the pain is still persistent, to start on a low dose of a opioid painkiller medication. Initially, you respond to the painkiller medication very well. You're given a small dose and your pain level comes down, you're able to function well, and you don't have side effects, so the treatment is successful. And let's also suppose that you're a good patient, meaning that you always take the medication as prescribed, you keep your appointments, and stay faithful to the terms of the medication contract to which you and your doctor have agreed. And by the way, medication contract is a great tool which helps make opioid prescribing and use safe, and we'll be discussing that more in other videos. But anyway, the medication contract sets all of the terms for taking the opioid medication, keeping it safe, for monitoring procedures to assure that it's not diverted and that you are in 100% compliance with the prescription directions. So after taking your pills at 10 milligrams, we'll say, for 12 months, you notice that they still have some effect on your back, but much less effect than you had initially. First 4 to 5 months, it helped a lot. But now your back has become painful again, it's harder to walk, you've stopped your neighborhood walks daily. Assuming that your underlying condition has not changed, that no new problem has developed, then, and it is the doctor's job to help determine this, then the reduction in pain relieving effect is called tolerance. Drug tolerance is a normal phenomenon when a person takes certain medications or alcohol over time. As the brain becomes used to the drug, its effect decreases over time, and you will require a higher dose, an increased dose, to achieve the same original effect. Again, this is normal and expected with these type of medications. Another illustration which people are familiar with is drinking alcohol. If a person does not drink or rarely drinks, and then she goes out to dinner and has 2 glasses of wine, she will likely feel tipsy or slightly inebriated from the alcohol. But her friend, who went out to dinner with her, regularly consumes 3 to 4 alcoholic drinks every evening, and she also has the 2 glasses of wine, but is not tipsy. In fact, the friend may feel nothing. Maybe she won't feel anything unless she drinks 4 or 5 drinks. The friend has built up a tolerance to alcohol. She, quote, tolerates alcohol, more alcohol than the companion, meaning that the overall effect of the alcohol on the body and brain is less. Same thing happens with opioid pain medication. Over months or a year, it may take a number of dose increases by your physician to achieve your original pain relief effect and functionality. So this not natural phenomenon of tolerance means that say you started taking 10 milligrams of medication originally, that 10 milligrams was initially effective, but 6 months later, you can expect to be getting less pain relief than originally, and this is because of the medication tolerance. Now, I want to keep this fairly simple, but when a person takes certain substances, including opioids, regularly over time, the brain cleverly tries to adapt to the medication's action on the brain, on the nerve cell level. This is part of its evolutionary instinct. In the case of tolerance, the brain cells try to reset such that it takes a higher concentration of opioid or alcohol or other drug to turn on, quote unquote, certain nerve pathways which cause the clinical effects of that drug, like pain relief or euphoria. Just like a person accustomed to drinking some alcohol every day will not be affected by a single drink much, a person after taking an opioid daily after time will become tolerant to its effects. Tolerance can be misunderstood by doctors as a manipulative or unwarranted seeking for more medications. Patients are sometimes called medication seeking when they want an opioid or want dose increases for their opioids. But it's important to remember that tolerance is a real phenomenon and really should be anticipated. So tolerance, in terms of how this plays out in a doctor-patient relationship, tolerance over a long period of time is often behind what clinicians perceive as, quote, large doses of pain medication or too much pain medication. So look at the reasonable dose increases required over a 30-year period to offset tolerance. If we look at the math there, it becomes obvious that the drug dose over that much time increases almost exponentially. So depending on how long a person's been on an opioid and how frequently the dose needed to be increased to account for tolerance, the dose could be 50 times what it was originally. So that again is a normal phenomenon. But rather than take that phenomena into account, some physicians today, and they're under pressure, but they view opioid doses on an artificial, one size supposed to fit all weighted scale, such that any patient on long-term opioid therapy is likely to not be seen as an individual with an individual history and individual needs, likely instead to be judged as to be taking too much opioid without any real fair basis of comparison. And realistically, doctors who prescribe those higher doses of, when a patient's been on opioids for a long time, can be vulnerable to investigations, to action on their license, etc. So this is a current major issue, which is discussed in some of the other videos. So that's all about tolerance. So besides tolerance, there is another important phenomenon occurring in the brain, in which the brain is also trying to adapt or normalize the presence of a drug, such as an opioid, and it is called dependence, but it's a little different. In dependence, the brain over time, while the drug is regularly present, slowly attempts to normalize the presence of the opioid by, quote, resetting itself, such that the presence of the opioid or other drug is normal, and the absence of the opioid or other drug is abnormal. It's like a thermostat, which when turned up, say, from 65 to 70 degrees, will then note that 70 degrees is the new normal or baseline. And so any temperature less than 70 will be noted to be too cold or interpreted as too cold, and the heating apparatus will be triggered. So in the brain, once that set point of the opioid presence, that level is set in the brain expects that opioid to be there at that level, and if for any reason it is not there, then the brain will label that or interpret that as abnormal and will do whatever it can to try and fix that situation. Now, the brain can't produce opioid, So what happens is a state of brain chaos ensues, which the patient interprets as drug withdrawal, all of the different symptoms of drug withdrawal. And that brain dysfunction will continue, and the withdrawal will feel worse and worse until or unless an opioid is taken. And so unless that drug is taken, the brain will not operate normally until they've gone through all of withdrawal, which is a few days. So basically, the brain depends on the drug in order to function, in order to function normally. Drug dependence means that enough of the drug must be taken regularly, or else the brain will go haywire, producing the state of drug withdrawal. And in withdrawal, a person is desperate to obtain and use more drug, but the physical symptoms can eventually be so incapacitating that they become unable to pursue getting more of the drug. It may take only a few weeks for certain people while taking opioids daily to become dependent. And it's irrelevant what type of opioid is being taken or why it's being taken, if it's prescribed or illicit. If or when the opioid is not in the body, perhaps a refill was forgotten, or the doctor cut off the prescription, or if an illicit opioid the user can't, quote, score, then the brain will start rebelling. It has learned to depend on the drug, and it will start producing severe craving and withdrawal. Opioid withdrawal is no trivial matter, as some people believe. Usually it's very intense, it can be dangerous, and even fatal. So any person regularly taking an opioid will become dependent on it. There's no way to avoid that other than to just not take the medication in the first place. And the same goes for for tolerance. Dependence doesn't discriminate between patients, between morphine or OxyContin or heroin or fentanyl. The same phenomenon occurs. So if I am dependent on a medication or I'm dependent on alcohol, what this means is I cannot function properly without it in my system. And in fact, I'll become quite physically ill and psychologically distressed as my drug wears off and is not replaced. In other words, I will be in a state of withdrawal. Again, this is normal. Say a person is prescribed an opioid, this is just going to happen. It's inevitable. So that's one key point to get across, that dependence is normal and natural, really unavoidable, as is tolerance. But neither tolerance or dependence equal addiction. Persons addicted to an opioid certainly are dependent. They're subject to withdrawal without it. And it's true that tolerance and dependence and episodes of withdrawal contribute to the definition of addiction, but addiction involves much, much more. Addiction is not present simply because of dependence or tolerance to a drug. Addiction involves changes in the brain such that the behavior, reward circuits, and survival instincts are taken over or hijacked, and the person loses capacity to stop using, behaves insanely, pursues the drug to the point of self-destruction. Addiction is not a dynamic or a phenomenon, but a complex medical condition or disease. Here is a definition of addiction as a reminder. And note that other videos delve into the definition of and the nature of addiction in more detail. I view addiction as a chronic, progressive, relapsing, and potentially fatal, but treatable brain disease characterized by the compulsive and obsessive use of a substance, total dependence on it for daily function, and eventually for survival, willingness to violate legal, ethical, and moral principles to use, continued use despite severe negative consequences directly related to using, and eventual global impairment of the person mentally, emotionally, spiritually, physically, and relationally, until the addiction dictates all decisions and actions of a person's life. So now that we've reviewed tolerance, dependence, and addiction, what they are and what they're not, and the differences between them, I hope that helps clarify some of what we're talking about in terms of whether persons taking a medication are addicted to it and what addiction really entails. And as always, I know these videos are brief and sometimes I have to go over things quickly. If there's questions or discussion, please feel free to post your questions and I'll do my best to respond. And I look forward to talking with you again soon. Thank you.